So this is a brief video that's going to talk about low flow devices. The devices that we're going to be focusing on are going to be the nasal cannula. We're going to talk about the simple mask as well, and of course the non-rebreather is what we will end up with. The other device that we have here on the table is called a bubbler. That is going to be added to the nasal cannula, which we will demonstrate in a minute. So the nasal cannula for your application on your patient, it's a very simple device, probably the most common device we put on our patients. Very simple. This one happens to be probably 7 foot. They come in all kinds of different lengths. As you look at the nasal cannula itself, if you can move this down the lariat to stretch it out for the patient, you'll notice that there are 2 prongs. Those go into the nair on the patient. You also want to make sure that you're following the natural path of the nose. So your application is going to be just like this as it goes into the patient's nose. Some of them will also have a little stand here that helps you know that that's going to stand right here on the lip, upper lip. Nasal cannulas can run anywhere from 1/4 liter up to as high as 6 to 8 liters, depending on what you're reading or what your hospital is doing. Most of your hospitals are going to transition to a different device at about 6 liters. Each increase in liter flow is going to change the percentage that we're averaging for that patient. Of course, because this is a low flow device, we're going to be looking, it's going to vary based on your patient's respiratory rate, how deep they're breathing, or how fast they're breathing, and of course the liter flow that we're setting it on. If I set a patient on a 1 liter nasal cannula, it's going to deliver approximately 24%. After that, it's going to go up about 4% per liter flow. So 2 liter nasal cannula is going to be 28%, 3 liter will be 32%, and so on. When I hook up my nasal cannula, I'm going to connect to the throat tube. My device, I'm going to dial in the liter flow, like if I wanted to use 2 liters for my patient. I'm going to dial that up to 2. I always want to make sure that I'm getting some flow out of my nasal cannula before I do place it on my patient. When I do go to place it on my patient, I'm of course going to explain to my patient that I'll be placing some oxygen on them. I'm going to hold the nasal cannula like so, again so that it's following the natural path of the nose. I'm going to insert it here. And then the easiest way is to hook it around their ears so that they're not laying on that tubing, because we don't want to cause a pressure sore on our patient. You can just increase the move the lariat a little bit up to make it a little bit snugger, but not too tight on the patient. And that's exactly how a nasal cannula will go on a patient. This bubbler that I had mentioned in the beginning, this is actually designed to add a little bit of relative humidity to the gas that the patient's breathing in. If your patient is telling you that it's very drying, that they're getting nosebleeds, or they're having problems, it's red and irritated, you're going to want to add some humidity to them. Most hospital policies will tell you to go ahead and add humidity at about 3 or 4 liters per minute, or it would be per patient request. The 2 pieces of equipment that come in here are going to be the actual water source itself. It's sterile water for inhalation, and then this is just the top of your connection that will hook up into the flow meter. I'm going to go ahead and set this up. This is just going to twist on the top. There's a puncture point that's going to puncture through the top of the bottle. Just twist on like that. You want it snug, but you don't want to over twist it. On my flow meter, I'm going to go ahead and turn that flow off for a minute. I'm going to take the actual tree off to go ahead and hook this directly to the flow meter. It's just going to twist onto the device like so. Now my nasal cannula connection is going to be off the front here. I'm just going to twist this off, and then my oxygen will connect right there. So when I turn on my flow, you'll notice that there's going to be a bubbling in the device. What's actually happening is the gas passes down through the back of the device as it bubbles up through the bottle. It picks up a little bit of humidity and it's delivered it to the patient. That makes it a little bit more comfortable, a little bit easier for them to be able to breathe, especially for long periods of time if they're wearing oxygen. So that would cover our nasal cannula and our bubbler. The next device that we'll go ahead and move to is going to be our simple mask. So I'm going to go ahead and take this off. Take that off of our patient. The next device is our Simple Mask. A Simple Mask is also a low flow device, so it is dependent on the patient's respiratory rate and how deep they're breathing, and of course their liter flow as well. This delivers approximately 35 to 50%. Your minimum liter flow on this device is 5 liters per minute, the maximum being 10 liters per minute. It needs to have a minimum of 5 to be able to wash out the exhaled CO2 that your patient is exhaling back into that mask. So that's why the necessity of 5 liters. I'm gonna put my tree back on. I'm gonna go ahead and connect my tubing. This is a very simple mask setup like this. I go ahead and put a minimum of 5 on here. I'm going to go ahead and I'm going to explain to my patient that I'll be putting a mask on them. It's going to fit over their nose and down over their chin. The strap will go around their head, and then you have the ability to adjust it so that it fits the patient appropriately by pulling on the 2 strings on each side. If you have a smaller patient, you can use this metal clip on the top here to kind of make it a little bit tighter so that there's not so much flow maybe blowing up into their eyes, something you need to be considerate of for your patients. So that would be the application of a Simple Mask. Again, 35 to 50%, liter flows 5 to 10 liters per minute. And that would be based on your patient's breathing pattern. I'm gonna go ahead and take this off. And we'll move on to the non-rebreather. The non-rebreather is a device that will deliver 60 to 80% to our patients. It's a very simple setup. It's also something that is our go-to for a patient that has a suspected MI or a patient that comes in as a trauma patient. Mask, of course, looks a little bit different. It is a low flow device again, so it does depend on the respiratory rate and how deep they're breathing and the liter flow that we set the device on. Your minimum on this device is going to be 10 liters per minute with as high as flush. The important part is that you want this bag to never deflate when the patient takes a breath in. So never deflate on inspiration. When you set this device up, you're going to connect it to your flow meter. I'm actually going to switch to this flow meter here. I'm going to connect it to my flow meter. And then I'm going to start out at 10 liters per minute. I'm also going to include this valve here because I want that bag to go ahead and inflate. The thought process behind this mask is that this is a reservoir bag, so what's happening is when the patient takes a breath in, they're pulling from this reservoir bag. You'll also notice that there's a valve on the outside. When the patient exhales, they can exhale out through it, but they can't entrain as much room air because of that valve on the outside. So your patient's going to be able to pull from a more of 100% in that bag as opposed to more room air that's going to dilute that, what we're delivering to them. So you want to make sure that's inflated before you put it on your patient. It's going to go on just like the Simple Mask, very simple. Just put it over the top here. You can tighten it again with those straps. The other thing that you want to be conscious of is that you don't want this bag covered with blankets or something that could deflate that bag a little bit. Always make sure that it's on the outside and that your patient understands the importance of that. The other important thing to mention is that if you're watching your patient breathing and you're seeing that this bag deflates when they're taking a breath in, you're going to want to increase your flow a little bit to be able to meet those demands for that patient. Thank you.